Hello everyone, welcome to today's lecture on pharmacotherapeutics. In this video, we will learn what is pharmacotherapeutics. We will understand its definition, meaning, and importance in very simple language. So, let's begin. What is pharmacotherapeutics? First of all, let us understand the meaning of pharmacotherapeutics. Pharmacotherapeutics is a branch of pharmacology that deals with the therapeutic use of drugs for the prevention, diagnosis, and treatment of diseases. It focuses on selecting the most appropriate medicine, determining the correct dose, route, duration, and monitoring the patient response to ensure safe and effective treatment. In simple words, it tells us how medicine should be used correctly to treat patients. It is not enough to simply know the name of medicine. We must know about which medicine should be given, to whom it should be given, what should be the correct dose, which route should be used, such as oral, parenteral, intravenous, topical, how long should the medicine be continued, and finally we should monitor whether the medicine is working properly or causing any side effects. All these points are included in pharmacotherapeutics. Let us understand this with an example. Suppose a patient comes to the hospital with a high fever. Will the doctor immediately give any medicine? No. The doctor will first examine the patient and identify the cause of fever. If it is a viral fever, medicines like paracetamol may be given to reduce the fever. If it is a bacterial infection, the doctor may prescribe an appropriate antibiotic. The doctor also decides how much medicine should be given, how many times should be the patient take it in a day, for how many days should it be continued, whether the medicine is safe for the particular patient. This complete process of selecting and using medicines correctly is called pharmacotherapeutics. There is another simple definition of pharmacotherapeutics. Pharmacotherapeutics is the application of the knowledge of drugs and diseases to provide the best possible treatment for patients while minimizing adverse effect and improving their quality of life. This means we combine our knowledge of diseases and medicines to choose the best treatment for the patient. The main aim is to treat the disease effectively, to reduce unwanted side effects, to help the patient recover faster, to improve the patient quality of life. Now let us understand what is meaning of pharmacotherapeutics. The pharmacotherapeutics word come from two Greek words. The first word is pharmakon and second word is therapeutics. Pharmakon means drug or medicine and second word is therapeutics which means treatment or healing. When we combine these two words, pharmacotherapeutics means treatment of diseases using medicines. This is one of the easiest way to remember the meaning. Why is pharmacotherapeutics is important? Why do we study pharmacotherapeutics? The answer is very simple. As future pharmacists, we should know about which medicines is the best for particular disease, what is the correct dose, what is the correct route of administration, what is the correct duration of treatment, what precautions should be taken, what side effects may occur, how can we ensure that the medicine is used safely and effectively. Without this knowledge, medicines may not work properly or may even harm the patient. Therefore, pharmacotherapeutics helps healthcare professionals provide safe, effective, and rational drug therapy. Now, moving towards branches of pharmacotherapeutics. There are two branches of pharmacotherapeutics, that is pharmacokinetic and pharmacodynamic. Let us understand each one in a very simple way. Pharmacokinetics. First, let us understand what is pharmacokinetic. Pharmacokinetic means what the body does to the drug. That means once a medicine enters our body start acting on that medicine. The body absorbs it, distributes it, changes it into another form and finally removes it from the body. This entire journey of the medicine inside the body is called as pharmacokinetic. We can easily remember pharmacokinetic by using the word ADME. What is ADME? ADME means A means absorption, D means distribution, M means metabolism, E means excretion. Now let us understand each step one by one. First one is absorption. Absorption means the movement of a drug from the site where it is given into the bloodstream. For example, suppose you swallow a paracetamol tablet. The first it reaches the stomach and then the small intestine. And from the small intestine, the medicine enters the blood. This process is called as absorption. Simply remember, absorption means entry of the drug into the bloodstream. Then second one is distribution. After entering the blood, the medicine travels throughout the body. Blood carries the medicine to different organs such as brain, heart, liver, kidneys, lungs and muscle. This movement of drug from the blood to different body tissues is called as distribution. For example, after taking an antibiotic, it reaches the infected area through blood and start working. So, distribution means the movement of drug from blood to body tissues. Then M means metabolism or biotransformation. Now the medicine reaches the liver, right? The liver changes many medicines into another form. This process is called metabolism or biotransformation. The liver contains special enzymes that break down medicine. Sometimes the medicine becomes inactive, while sometimes it becomes even more active. Most drug metabolism takes place in the liver. So remember, metabolism means chemical change of a drug mainly in the liver. Excretion means elimination. Finally, after doing its work, the medicine should leave the body. This removal of the drug is called excretion or elimination. Most medicines leave the body through urine, feces, sweat, breath. The kidneys are the main organ which are responsible for removing drugs from our body. So, excretion means removal of drug from our body. Next is pharmacodynamic. Now let us study the second branch. Pharmacodynamics means what the drug does to the body. In pharmacokinetics, the body acts on the medicine, but in pharmacodynamics, the medicine acts on the body. It explains how a medicine produces its effect. It also explains how medicine work, where they work, why they work, what effects they produce. So here first is mechanism of action. Every medicine has a specific way of working. This is called as its mechanism of action. For example, paracetamol reduces fever by acting on the temperature control center in the brain. Second example is amlodipine lowers blood pressure by relaxing blood vessel. So different medicine have different mechanism of action. Second one is drug receptor interaction. Many medicines work by attaching to special protein called as receptor. You can imagine it like a lock and key model. Here medicine is the key and receptor is the lock. When the correct key fits into the correct lock, the medicine produces its effect. This is called as drug receptor interaction. And third one is therapeutic effect. The desired or beneficial effect of a medicine, it is called as therapeutic effect. For example, paracetamol lowers fever, insulin lowers blood sugar level, antibiotics kill bacteria. These are the therapeutic effects of drug. Then, side effects. Sometimes medicine also produce unwanted effect. Here unwanted effect means side effects. For example, some antibiotics may cause nausea or diarrhea, and some painkillers may cause stomach irritation. Not every patient experiences side effects, but healthcare professionals should always be aware of them. Next one is dose-response relationship. Another important concept in pharmacodynamics is the dose-response relationship. It means the effect of a drug depends on its dose. Generally, a small dose produces small effect. As the dose increases, the effect also increases. However, after a certain limit, increasing the dose further may increase side effects instead of improving the therapeutic effect. Therefore, medicines should always be taken in the prescribed dose. Let us discuss what is difference between pharmacokinetic and pharmacodynamic. Now let us compare both branches. Pharmacokinetic tell us about what the body does to the drug, while on the other hand, pharmacodynamics tell about what the drug does to the body. Pharmacokinetics studies ADME parameter, that is absorption, distribution, metabolism and elimination, while pharmacodynamics studies drug action. Pharmacokinetic describe movement of drug, while pharmacodynamic describe effect of drug. Pharmacokinetic helps to decide the correct dose, while pharmacodynamic helps to predict therapeutic and side effect. So student, in today's lecture we understood the meaning and definition of pharmacotherapeutics in a simple way, and also learned that pharmacotherapeutics have two different branches, that is pharmacokinetic and pharmacodynamic. Pharmacokinetic, which explain about what the body does to the drug, and pharmacodynamics, which means what the drug does to the body. Both branches are equally important because they help us understand how medicines work safely and effectively in the human body. Thank you for watching this lecture. If you found this video helpful, please like, share, subscribe to the channel. See you in the next lecture with another interesting topic in pharmacotherapeutics. Thank you.